there are versions of this. I said, no, I don't want the C or the D. I want the A+. And we did it the A+, so I'm very happy with that. And I think you're going to see things. It's kicking in immediately. It'll kick in as of today. But it's going to really start going during the course of the year, the following year, this year coming. And you'll see some results that are going to be actually incredible in terms of costs coming down. And I think in terms of the quality of the care, because you're picking people that you'd want to be with. This afternoon, we're grateful to be joined by Secretary Steve Mnuchin, wherever you may be, Steve. Steve. Hi, Steve. Secretary Jean Scalia, and I hear you're really doing a job over there, huh? Labor's doing okay. Your numbers are certainly doing very good. It's a good time to be Department of Labor, right? This is a
great story to tell.
Right. Thank you very much. Good. Secretary Alex Azar. Thank you, Alex. Thank you. Thank you, Alex. And Administrator Seema Verma. Thank you very much, Seema. Seema. It's an unusual group today. They're spread all over the place. I also want to welcome Representatives Kevin Brady, Michael Burgess, and Greg Walden. They've been so fantastic on getting us to a really good position with the taxes. We're going to be doing a major middle-income tax cut if we take back the House, and we'll be talking about that sometime later. But we're going to be doing a very major middle-income tax cut, mostly devoted to middle income, who have really been big beneficiaries of the tax cut we did, which was the largest in the history of our country. But we're doing a major tax cut for the middle income, and that'll be subject, obviously, to taking over the House because Democrats like tax increases, not tax cuts. I also want to thank our state leaders. We have a lot of state leaders here today at the highest level, and I want to thank them for being here. And a special thanks again to highly respected economist Dr. Art Laffer, Dr. Larry Van Horn. And really, it was those two people that came to my office. We were talking about Art, and we were all congratulating him because he did an incredible job over a lot of years with Ronald Reagan and beyond. And when I said the Presidential Medal of Freedom, which is the highest civilian award you can get, he told me this little story about a certain hospital he was involved with where they did this, and every hospital's had just incredible experience with it. And I said, tell me more. And then we got involved with Larry and Larry Kudlow also, by the way, and we had a little group of 4 people that talked about it a lot. And I think it's going to have a tremendous impact. And again, the statement was made, this is bigger than health care. And I think it will be. I think it'll be more meaningful in many ways. You'll save so much money, and you'll get the care that you want, and you'll choose the doctor you want, which was not possible despite the many pleas. You know, you can have your plan and you can have your doctor. Well, they turned out to be untrue statements about Obamacare. For decades, hospitals, insurance companies, lobbyists, and special interests have hidden prices from consumers so they could drive up costs for you, and you had no idea what was happening. You'd get bills that were unbelievable, and you have no idea why. For example, researchers found that for the same MRI at the same hospital, patients were charged anywhere from $248 to $2,500, so 10 times more in the same hospital. I assume that would be different doctors within the same hospital. I don't know if the hospitals are going to like me too much anymore with this, but that's okay, right? That's okay. I think the doctors are going to, actually. In the Boston area, the price of delivering a baby can cost anywhere from roughly $4,700 to nearly $16,000. One survey found that within a single metro area, the highest negotiated price for a simple blood test was roughly 40 times more than the lowest price. They were given exactly the same service, in some cases sent them to the same labs, and would charge 40 times more money. Under the new price transparency rule, we are finalizing today, and it'll be all finalized. It is finalized. It'll be put out today. All of that will change. Hospitals will soon be required to publish the price of everything from individual medical supplies to the total cost of common procedures. Next, we will bring much-needed price transparency to insurance companies. I'm sure they'll be thrilled. This will allow you to see your out-of-pocket costs and other vital price information before you go in for treatment. So you're going to know what it's going to be, and you're going to be able to have lots of choices, both in terms of doctors, hospitals, and price. And we're stopping American patients from just getting pure and simple, 2 words, very simple words, ripped off, because they've been ripped off for years, for a lot of years. With us today is Melissa Earl, who works for a company that benefits from price transparency. And Melissa, could you come up and say a few words? Right?
Yes.
Thank you, Melissa. Thank you very much.
Thank you, Mr. President. My name is Melissa Earl, and I am the Vice President of Human Resources for HB Global. We are an employee-owned mechanical contracting company. Transparent pricing initiative aligns with our ownership model because it allows employees to get the care that they need at the cost that they want. Currently, we are partnering with a broker to work and negotiate prices for surgeries and other procedures at local surgical centers. This allows our employees to know what the procedure or what the cost will look like when they walk through the door. This also allows our employees to get great care at a fraction of the cost with the same quality and standard of care that they would have gotten, and they won't receive any surprise bills. Right now, we have some price transparency behind the scenes, but with full price transparency up front, our employees can make the best decisions possible. We wouldn't expect our employees to go buy a car or a house without knowing the price up front. Why should their health care be any different? I want to thank the President for bringing this important initiative to the front.
Thank you very much, Melissa.
Thank you.
Thank you. Good job, Melissa. We're also joined by Kara Buckle, who works for the same company and benefited when her employer shopped for the best price on a surgery that she needed. And I'd like to have Kara come up and please tell us about it. Kara, please.
Thank you. My name's Kara Bakel, and I work for HB Global along with Melissa. And in January of this year, I had surgery on my ankle. I'm the sole provider of my 2-year-old son, so this impact was huge for his and my day-to-day life. When I initially went to an orthopedic urgent care, I had no idea what I was going to pay, no idea what the costs were going to be. I just know that I needed to get help. I ended up with a bill for over $1,000. This was an unexpected expense that my family now had to endure, and it had a huge impact on us. It was a huge stressor to know that I needed surgery and not know what the cost was going to be and how it was going to impact my life. Thankfully, my company was able to work with a brokerage firm and shop around to know what prices were going to be beforehand. With insurance, the claim my company would have paid was $19,500, and we wouldn't have known that cost until afterwards. By shopping around beforehand, we knew the claim was going to be $7,800, which is a 60% price difference, and it was at zero cost to me. I was even able to get the care at the same facility that I was going to go to if I would have used my insurance. I want to thank the President for making healthcare more transparent so that others in my situation don't have to have these unexpected financial surprises and hardships.
Thank you very much.
Thank you.